The motor testing that we're going to do is going to be two types of motor testing. The first thing we do to assess disease is we listen to the patient. What can they do? What can't they do? If they have difficulty going upstairs, again, that suggests the proximal weakness, difficulty getting out of a car or a deep seat. And then when you go through and do the physical testing for the motor patients, we will focus on what do we see in strength testing. We have a scale that we use that's from 0 meaning no strength to 5 being normal strength, and we look at where they are on that scale in terms of their strength, and we see if there's any relative weakness that's involved. For the infants, for the kids that have this, we also have other functional scales. We have the Hammersmith scale, we have different right upper limb modules, we have different scales that look at the developmental milestones they're supposed to reach. And in some of these patients, as you monitor it, you will look at, are they able to sit up? Are they able to roll over? Okay, so those motor scales for the pediatrics tend to be more functional. What can they do? But when you get older into the adults or the kids that can cooperate, instead of just doing that, you're actually scoring how strong is the muscle on that 5-point scale. So the decline in motor function is really, it can be variable. This is something that's actively being studied. We know in the natural history of the disease, there will be a gradual, slow decline. The pediatric patients will start to reach their milestones, and then they'll start losing their milestones, and they'll gradually get worse. As you get towards the type 2s and 3s that'll present later in childhood, or even those type 3s and 4s that present in adulthood, again, they'll meet these milestones, but when they start declining, they begin a gradual, slow decline. There are modifiers to that, and that's what we don't understand. Why do some people decline faster? Some people decline slower. It may be other genes that are involved. It may be the way they're managing their disease. There are ways to manage this disease that should be able to slow the decline.